We went to visit my daughter in New York, and we were taking the train to Grand Central Station. And we got off the train. I was feeling fine. I didn't feel sick or anything like that. And I told my wife that let's stop to get some water. Suddenly, I just passed out. There was a guy who was in front of us, and he came back and he started to do cardiac massage, and they called the police to bring the defibrillator. More likely I will not be here today. Yeah, that really was a lifesaver.
An AED is an automatic external defibrillator that is used to detect abnormal heart rhythms and, if necessary, deliver a defibrillation shock to help restore normal rhythm. Well, time is muscle and time is brain, so accessing the defibrillator quickly is important. They are designed to be user-friendly, so they will talk you or show you how to attach it to the patient. If you see a person collapse and they become unresponsive, obviously the first thing you want to do is call 911 to activate emergency response. But then you would want to locate and obtain the AED. So normally this would be stored inside of a cabinet on the wall. What you would want to remove it from the cabinet and sit it next to your patient, and you'll remove the defibrillator from the case and then open the AED. This particular model has a separate headpiece that can be put underneath the patient's head for support. But once you open it up, the pads are already in this particular model. Sometimes they will be in a separate pouch with the AED, but the pads will be connected in to the AED. Once you have opened the device, you'll want to power it on and then follow the prompts to attach the pads to the patient. And there generally will be a picture on top of the package as far as where to place it. The nice thing about these is that it's all one piece, so you just lay it on the patient's chest. It will begin analyzing the patient's heart rhythm to determine whether or not a shock is appropriate. If it is appropriate, the device will either automatically deliver a shock and will tell you to clear the patient, or it will inform you that a shock is advised and then allow you to manually shock the patient through the AED with a button.
Know where the closest one is located, and quite honestly, to make sure that the battery is charged. They're becoming more and more common now, particularly at sporting events and in large areas. So most workplaces will have one somewhere in the building. Most of your schools will have one as well. It's also important to ask your supervisor at work if you have one. If you don't have one, is it possible maybe for your business to purchase one?
Well, I think go to Grand Central Station again and try to be able to go to see the show with my granddaughter.